Hello, Miss S. My name is Julie. I'm going to be doing your health assessment today, um, and we're going to be going through some things. I'm going to be evaluating several of your body systems. All right. First thing I'm going to do, I'm going to wash my hands, but I'm going to use hand sanitizer. Okay. I noticed from some of your history that you have a significant history. Your family history consists of hypertension and high cholesterol. Your grandmother actually had a stroke. Your mother's had some skin cancer on her face. But your blood pressure and everything looks good. But it's going to be very important that you monitor your cholesterol because even your sister has high cholesterol. So it seems to run in your family, and high blood pressure. So diet and exercise and lifestyle changes can really help with that. Just stay active. You told me that you're on a regimen now where you're trying to lose some weight, and that's good. Okay. Your vital signs were 97.8 temp-wise. Blood pressure was 105/72. Your heart rate was 72, and respiration was 17. So that's very good. Now you are a little overweight. Your weight was 175, and your height is you're only 5'2". So that gives you a BMI of 32. You really want to get that down below 30, okay? And with the exercise regimen you're doing, you told me you're exercising at least 3 times a week, walking 1 or 2 miles, all right? And you told me that you're also planning to have a breast reduction done in September, which will help you get more physically active, okay? So is there any questions you want to ask me about any of that? Okay, well, we're going to get started. The first thing we're going to do is we're going to do the Snellen eye chart test. Okay, I'm going to take you back 20 feet, which is going to be back behind the sofa over here. I want you to read me the farthest line down that you can see clearly. Okay, we'll do that with both eyes open. Then we're going to swap and do it with the left eye closed and then with the right eye closed. Okay, all right, now if you will, let's just walk around to the back of the sofa. All right, and you just tell me when you're ready and read the lowest line on this chart that you can see.
DEFPOTEC.
Okay, that's at 20 feet. Okay, cover your left eye. Now read the farthest line down that you can see.
DEFPOTEC.
Okay, now cover your right eye.
FELOPZB.
So there is some vision changes between your left and right eye. The right eye you read at 25 feet. The left eye you read at 20 feet. Okay, if you will, just come back around and have a seat in this chair. We're going to do a near vision test. And I have this little card here where I have your vital signs written on. I'm going to take this little card. I want you to take this little piece of paper here. And I want you to do the same thing with this chart right here. First, I want you to read it with both eyes open. And I want it to be about 16 inches from your face. Okay?
Can you read with both eyes?
Both eyes open.
DZECLPTOF.
And that line is located at 24 inches. Okay? Now we're going to cover up your right eye and do the same thing.
Okay. LOPFZEDCT.
Okay? And that is at 20 inches. Okay? With the left eye. Now we're going to cover the left eye and you read from your right eye.
LOPFZEDCT.
Okay? And that is from 20 inches. Okay. Very good. And you do wear contacts, correct?
Yes,
And you did have those in.
Yes, ma'am.
Okay. Now, what we're about to do now is I'm going to inspect your scalp. We're going to do your scalp, your skin, your eyes, your nose, your mouth, and your neck. Okay? Now, do you have any visible moles, lesions, or anything like that over your skin?
No.
Overall, your skin looks very good. I see no superficial or varicose veins noted. I do not see any distinguishing moles or scars. Okay. Hair is soft. It's a little dry on the ends. Do you use conditioner or have you been taking any medications lately?
No.
Okay. Do you use chemicals in your head?
No.
Blow dryers?
No.
Okay. Do you have a lot of dandruff in your head?
No.
Okay. Your scalp looks good. Okay. It's pink. No lesions or anything you've noted in your head?
No.
Okay. All right. Now we're going to be checking your face. So I'm going to be touching you throughout this exam. So anytime you feel uncomfortable or if you don't want me touching you, make sure you let me know, okay? We're going to start off by checking your sinuses. I'm going to check your frontal sinuses, your zygomatic maxillary sinuses. Tell me if you feel any pressure, pain, or anything like that, okay? Okay. I'm going to percuss them. Any pain?
No.
All right, now I'm going to check your eyes. Okay, you're going to feel me touching your eyelids. I want you to close your eyes. No nystagmus noted. Okay, I'm going to check your orbits. Upper, lower. I'm going to check your lacrimal apparatus. That's intact. No exudate or drainage noted. Okay, now open your eyes. Look up for me. I'm going to check your conjunctiva. Okay, that's pink and moist. Look down for me. I'm going to lift your eyelids. Pink and moist. And your sclera is white. Okay, I'm going to check your trigeminal joint. Okay, which is right here. Okay, open and close your mouth. No clicks noted. One more time. Okay. I'm going to check your temporal artery. Okay. I'm going to just take a listen to it, make sure there's no bruit. A bruit could mean there's stenosis there, and so you're not getting enough blood flow through your brain. No bruit noted. Okay. Now, I'm going to check your lymph nodes. Okay. Your preauricle, postauricle, submandibular, submental, superficial cervical, deep cervical, supraclavicular, posterior clavicular. Okay, they're all small, soft. Do you notice any pain at any of these sites that I just touched you at? Okay. All right. Now we're going to check your trigeminal nerve. Okay. I'm going to take a little piece of gauze, and I want you to tell me when you feel it touching you on your face. Okay.
Yes. 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 Yes.
Okay. Trigeminal nerve intact. All right, now I'm going to check your nose. It is midline, no deviation. Nares are equal. Do you notice any drainage? Do you have any allergies or anything? Okay. Open your mouth. Okay, it's pink and moist. I'm going to take this tongue depressor. Okay. Just look around in your mouth. No lesions noted. Good dentation. Okay. Can you stick your tongue out for me? Okay. Move it from side to side. All right. Now I'm going to check your glossal nerve. I want you to stick your tongue. Okay. To one side. Okay. Now okay. And check the resistance on your tongue. Okay, the glossal nerve is intact. Can you stick your tongue out? Say ah.
Ah.
Uvula is midline intact. Tonsils are 1+. Okay. Hypoglossal and vagus nerve intact. Just stick your tongue out for me. Okay. Positive for gag reflex. Now, I'm going to check your facial nerve. So I'm going to put a little Q-tip on the back of your tongue. You tell me what you taste, okay?
Okay. lemon juice.
Okay, facial nerve intact. We're gonna check your olfactory nerve. Okay, I'm gonna close one nostril. Can you tell me what you smell?
Coffee bean.
Okay, give you just a second. We're gonna test the other side.
Coffee.
Okay, now we're gonna do a little test with your eyes. Okay, this is gonna check your ocular motor muscles and the nerves in your eyes. Okay. All right, so I want you to look at my finger, and I want you to follow my finger. Okay, and that's the cardinal gaze. That is intact. Okay. Look at my finger. Look at a point on the wall. Now look back at my finger. Okay. Now I'm going to cover one eye. I want you to look at a point on the wall. Okay. The ocular, trochlear, and abduction nerves are intact. Okay. I'm going to just clean my hands off for just a second. All right. Now, I'm going to go through, I'm going to check your ears. Okay. I'm going to check your tragus, your auricle. Do you have any drainage or exudate in the mornings when you wake up or anything like that?
No.
I do see that you have 2 holes in your ears. Do you normally wear earrings?
Yes.
Okay. All right. We're going to check your neck. I feel no nodules. Okay. Let's see. All right. Can you put your chin to your chest and lift up? Head back, forward. Turn left to right. Can you tilt your head from the left to the right? Okay. Now, turn to the left. Can you turn your head back? Okay. Turn your head to the right. Now push your head back. Okay. All right. Sternocleidomastoid muscle intact. Okay. I'm going to check your accessory nerve. Raise your shoulders. Resist me pushing them down. Okay. Now lower. Okay. All right. So, her trigeminal nerve, facial nerve, ocular, oculomotor, and abduction nerves are all intact. We're going to check her acoustic nerve. Okay. So what I'm going to do is I'm going to hold your ear, hold one ear closed, and I'm going to say a 2-syllable word, and I want you to tell me what that word is. Okay? Okay, and what was the word?
Wheelchair.
Okay, and do the opposite side. And what was the word?
Trash can.
Okay, acoustic nerve intact. Okay, so we have the trigeminal nerve, we have the ocular, we have the olfactory, we have the abduction, we have the facial, we have the glossal, the hypoglossal, and the acoustic nerve, and the accessory nerve all intact. Okay, now we're going to move on to the respiratory. Okay, you're going to feel me touching your chest. I'm going to be listening to your chest. Okay, we're going to start with the back. Okay, the back is straight, no curvature, so that means no kyphosis. All right, can you stand for me? I just want to look at the curvature of your back. Okay, can you bend over for me and touch your toes? Okay, have a seat. So no scoliosis. I'm going to just feel your spinal processes from your neck down. That is good. Now I'm going to listen to your chest, okay? When I ask you to breathe in, just take a deep breath in, and I'll tell you to exhale, and you let the breath go, okay? Breathe in, out, 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 in, out. Okay, I hear no wheezes or crackles. Okay, bronchial vesicular sounds, mid-scapular. Okay, they're equal inspiratory and expiratory. Vesicular sounds in the lower bases are longer on inspiration than expiration. Okay, now I'm going to check for tactile firmness. You're going to feel me put the palms of my hand on your back. Okay, and I want you to repeat the word 99. Can you slide up in the chair a little bit? Just slide to the edge. All right, can you say the word?
99. 99. 99. 99. 99.
Okay, no tactile firmatitis noted. Okay. Hyperresonance would mean that there is increased airspace in the lungs or either in this pleural space, which could mean that there's a pneumothorax or you have asthma. Dull resonance would mean that there might be some atelectasis in there. Okay. All right, now I'm going to turn around to the front. I'm going to do the same thing in the front. Okay. Breathe in, out. Breathe in, out. Breathe in, out. Breathe in, out. Breathe in, and out. In, and out. Now, I'm going to do the same thing on the front, and you repeat the word 99.
99. 99. 99. 99.
Okay? Now, we're going to move over to the sofa, and I'm going to check your heart, okay? All right. If you will, turn the computer. All right, I need you to turn the other way. Yeah, with your head that way. Okay. I want you to be at about a 30-degree angle, so I need for you to kind of set up, put your head up this way. Okay. What we're going to do is we're going to assess for JVD. Jugular vein distension could mean that she has some type of heart failure going on. All right, just turn your head to the side. Okay, no JVD noted. Okay, I'm going to check your pulses. Let's start by checking your radial. They are 3+, that's normal. Brachial. Okay. Can you bend your leg, uncross your legs for me? Bend your leg. And check your popliteal. That's about a 2+. Can you bend this leg for me? And that's about a 2+. All right. We're going to check the posterior tibial. That is 2+. okay, and the dorsal pedis. Those are 3 plus, okay. And while I have you in this position, I'm gonna go ahead and check for the Homan sign. Can you just bend your leg? I'm gonna dorsiflex your foot. Do you notice any tenderness in your calf?
No.
Okay, so that means Homan sign is negative. Let's repeat this side. Any tenderness?
No.
Okay. Now, I'm going to listen to your heart. Okay. We're going to be looking for any murmurs or S3, S4, gallops, or anything, or summation, or anything like that. Okay. S2 is intact with the aortic and pulmonic valve closing. Listen at the apical pulse, which is at the fifth intercostal space of the chest, which is also the mitral and tricuspid valve closing, which is the start of S1. Okay, I hear no murmurs. There's no S3 or there's no S3 present or gallops, which means it's highly unlikely that you have heart failure at this time. There's also no presence of summation, which is an increased blood flow going through the ventricles. The ventricles would not be expanding as they should. Okay. Now, while I have you in this position, I'm gonna go ahead and do your abdomen. Okay. First of all, I'm gonna palpate for any tenderness. Let me know if you have any tenderness in any of the quadrants. Okay, what about in the bladder area? Okay. And when was your last bowel movement? Today?
Yes.
Okay. Now I'm going to be listening to your stomach. I'm just checking how peristalsis is going. Peristalsis is the movement of everything through your gut. Okay. You have good bowel sounds. Now I'm going to be listening to your arteries in your abdomen. We're going to listen at the aorta. We're listening for bruits. The renal artery. And the iliac artery. Okay. No bruit is noted, so that means there's no stenosis, so your organs should be getting blood flow to them correctly. Now, since I have you lying down, we're going to go ahead and check your hip muscles and flexions and everything, and then I'll get you to sit back up in the chair, and we'll finish doing our assessment, okay? What I want you to do is bend your knees, okay? I want you to resist me pushing your leg down, okay? Now resist me pulling it up. Same thing with the opposite leg. Bend at the knee. Resist me pushing it down. Resist me pulling it up. Okay. Now resist me pushing it to your left. Resist me pushing it to the right. Okay. Same thing with this leg. Resist my hand. Okay. Now, can you turn on your side? Just slightly on your side. Okay. Now, bend your leg. Okay. Resist me pushing your leg. Resist me pulling it. Okay. Can you turn and do the same on the other side? Okay. Resist me pushing down. Resist me pushing up. Okay. All right. Now you can sit up, Miss S. And if you will, just go back over here to the chair. All right. Now, one thing I want to go back and do, I need to check your thyroid. I forgot that and skipped over that, so I want to go back and check your thyroid. So you're going to feel me touching your neck again, okay? So I'm going to place my fingers between your thyroid and your sternomastoid muscle. I'm just going to shift it from side to side. Okay, it's intact. Trachea is intact. Okay. Now I want you to take this glass of water. And while I'm holding pressure on your thyroid, I want you to take a swallow. Let me get my hand in place. Swallow. Okay, thyroid's intact. Now I want you to do the same thing when I come around to the back. Okay, thyroid's intact. Now I'm just going to listen to your thyroid and make sure there's no bruit. And I want you to hold your breath while I listen to your carotid. Okay? Okay. No bruit noted. One thing about the carotid, you don't want to press down on it too high up because you can stimulate the vagus nerve to cause a decrease in heart rate and blood pressure, and you can even pass out. Okay? Thank you. All right. Let's check your eyes. You're going to see me put this on the bridge of your nose right here, okay? All right. Right reflex is intact. Okay. Now you're going to see, can we close that blind right there? I'm going to dim the area, and you're going to see me move this light in. I just want to check how this is. Okay. Okay. All right. With all the tests we've done, okay, your nerves are intact. Your eyes are pearl, which means your pupils are equal reactive to accommodation, to light and accommodation. Okay, your thyroid's intact, your carotids are good, your temporal artery is good. All right, now we have to finish out checking your reflexes, and then I think we can be through. Okay, right now I'm just going to check. I want you to hold your hands out like this. Okay, I want you to resist me squeezing your fingers together. Okay, now close them. If you could open that blind for me, please. Okay, let's do that test one more time. Open. Now resist me closing them. Okay. Do the same. Resist me open them. Okay. Now ball your fist up. All right. Resist me open it. Now put your arms down by your side at a 90-degree angle. Okay. Now resist me pushing them down. Resist pushing up. Okay. Resist pushing out. Okay. Now resist pushing in. Okay. Now hold your arms straight out. Okay. Resist me pushing down. Resist me pushing up. Okay. Now we're going to do the same thing with the feet. If you could tilt it so we could capture this. Okay. And you do not have any edema noted in your ankles or your feet. That's good. That's a good thing. Okay. Now resist, lift your foot. Okay. Now, resist me pushing down, pushing up. Okay. With the same with this foot. Okay. Now, let's do the same thing with the knee. Raise your knee, resist me pushing down, pushing up. Okay. Same with this one. Pushing down, pushing up. Okay. Good. All right, now I'm going to have you do a few little tests for me. I'm going to need you to get up and walk. Okay, first thing I want you to do is what we call a Romberg test. I want you to stand like you are, arms inside. Okay, and I want you to close your eyes. Okay, now open. All right, that test is intact. There's some swaying, but that's normal. Okay, now we're going to do a pronator drift. I want you to hold your arms out like this with palms up and close your eyes. Okay, that's good. All right, now we're going to do a little walk test. I want you to just walk straight out. I want to notice your gait. Okay, and go back. All right, now what we want you to do now, I want to see you walk heel to toe, all the way out and turn around and come back and sit down. Okay, heel to toe. Heel to toe means like this right here. Okay. And turn around. Okay, that's good. Now I want you to do the same thing, but I want you to walk out on the heels of your feet. Okay? And then when you turn around, I want you to walk back on your ball or the tiptoes. Okay? Turn around. Okay. All right. Now you can have a seat. All right. Now we're going to be doing a few tests here. The stereognosis, the graphesthesia, and the point location. Okay. The stereognosis test, I want you to close your eyes. Okay. And I'm going to put something in your hand, and I want you to identify what it is. Okay? Let's see your hand. Raise your hand.
A hair tie.
Okay. All right. Now we're going to do the graphesthesia, which is I want you to close your eye. With your eyes closed, I'm going to write something in the palm of your hand, and I want you to tell me what that is. Okay?
Number 8.
Okay, that's good. All right, now we're going to do another test called point location. And what I want you to do is I want you to have your eyes closed. You're going to feel me touching you in an area of your body. And then I want you to open your eyes and tell me where I touched you at. Okay? Eyes closed. Open them. Now touch where I touched you at. All right, let's repeat. Okay, eyes closed. All right, Miss S. There is, I want to do a point movement test, which tests your neurological, and I also want to do a palm test, where you're taking your palms and turning them back and forth on your thigh to check your neuro status, okay? So I'm going to just sanitize my hands. Okay, now, I'm going to have my finger out in front of you. I want you to look at my finger. I want you to touch my finger with your finger and then touch your nose. Okay? Give me time to move it. Okay? Now, I want you to touch the palms of your hands to your thighs. Now turn them over. And I want you to do that as fast as you can. Okay? That's fine. Any deviation in this right here will show maybe a brainstem problem in the neurological function, but her neurological function is intact. there's one thing I want to add to your health assessment. I know I said your trigeminal nerve was intact, and it appears to be, but I need to add one more test to just make sure that it is intact, okay? So I'm gonna sanitize my hands again. Now for the trigeminal nerve, what I want you to do is I want you to raise and lower your eyebrows, okay? I want you to bear down with your teeth, smile broadly, okay? Now puff out your jaws, okay? Now just close your mouth and resist me open it, okay? Trigeminal nerve is intact. I also want to recheck some of your reflexes. I want to check your brachial, your triceps, and your patellar reflexes, okay? So we're going to do all four of those, okay, on all four extremities. So I'm going to I don't have the little hammer, so I'm going to just use the end of my stethoscope, okay? All right, brachial nerve on right arm intact. Okay, now we're going to check the tricep nerve. Let's see if we can turn where they can see. Okay, it's intact. One more time. All right, brachial nerve intact. I'm going to check the trigeminal nerve. I'm sorry, tricep nerve. Reflex, tricep reflex. Okay, tricep reflex is intact. Now we're going to check the patellar reflex. Okay, right leg intact. Yeah, don't lift up. Just rest your arm, rest your leg on my arm. Okay, left leg intact. Okay, and that concludes my health assessment. Okay, Ms. S., in this segment, what I want to discuss is the importance of doing a breast exam. Okay, a monthly breast exam for breast cancer. I didn't see any history of that in your family history or in your history, but it's very important that you do this every month because a lot of women go undiagnosed with breast cancer, and it can be curable if it's caught early enough, but a lot of times it's caught in the later stages because men and women are not doing what they should do. Even men should do breast exams every month, okay? So what I want to do is go through and kind of show you what to do, and you just repeat it back to me, okay? The best time to do a self breast exam is in the shower when you have soap on you. That will allow your fingers to slide over your breast a little bit better. Or if you're lying down, if you're out of the shower and you're in the bed, you lie down with your arm behind your head and place a towel up on your shoulder where you can lift your side up so you can get to it a little better. But what you want to do is you want to raise your arm over your head, okay, when you're in your shower. You want to start in the axillary area, take 3 fingers. You want to do like a soft feel, a medium feel, and then a firm feel, okay, assessing each part of the muscle or the breast tissue. Okay, so you want to go all the way around in a circle, okay, and just go all the way around to your areola. Now when you get to the areola, you want to pinch it, make sure you have no discharge or anything like that. There is a vertical method that you can use where you start and just kind of feel and go down, and this like this right here, and just go all the way across your breast, okay? When you're looking at yourself in the mirror, you want to look at the symmetry of your breast. You want to stand like this right here with your hands on your hips, and you also want to lean forward, okay? And note any abnormalities and discuss that with your doctor when you go in for your physical, or maybe you need to make a appointment and go in and have a checkup done, especially if you feel any lumps. Now the best time to do a breast exam is maybe about 5 days after your period, okay? Then your hormones are more imbalanced and your breast is not as tender, and some of the nose in there may not be as tender and swollen. Okay? Do you have any questions?
No.
Okay, do you do a self-breast exam every month?
No.
Okay, well, it will be a good thing to start, okay? You are planning on having surgery in September, correct?
Yes.
So, make sure you get on that regimen. All right. So all those are intact. Now what we just checked, we checked your neurological function, we checked your flexion, extension, we checked your abduction and adduction, motor reflexes. Okay, and that concludes our health assessment.